We're going to start off with a bit of a conversation, and then we're going to open it up to everybody. And so think of some good, tough questions to put us all on the spot, to put them on the spot, and then we'll take it from there. But first of all, let me just introduce. We'll each introduce ourselves. I'm Nicholas Kristof. Maudlin, 1981, journalist, and I got interested in these issues because of that wonderful Oxford vacation system. Since I was doing a BA, then the idea that you could study for 8 weeks and then disappear off to Africa or India for 6 weeks, and then try to earn a little bit of money writing about it. I just found that the idea you could actually get paid for this was extraordinary, and so that really fed my interest in international development issues. I'm just in from the Syria-Jordan border, which makes one appreciate Oxford all the more. Mark Suzman, Mark, introduce yourself a little bit. How you got engaged in these issues?
Great. So Mark Sussman, 1991, Balliol, and I actually started involved in these issues same way as Nick, as a journalist working for a couple of papers, most recently and for the longest stint with the Financial Times, covering a lot of issues in Africa, and then in London, and then in Washington, and jumped from there for what was supposed to be a temporary leave of absence to the UN at the beginning of the 2000s, which turned out to be a big turning point in global development, which I hope we'll talk about a bit today, in terms of as a real shift in sort of global trends and acceleration. I got caught the development bug about how do you really work and help developing countries, particularly focused on Africa, but globally, really accelerate improvements for health and human poverty. And so spent 7 years at the UN, and then from there jumped to the Gates Foundation, where I currently am, based in Seattle, but working very deeply on all these issues with very much a focus on the world's poorest. So that's the background. Looking forward to a great discussion.
Mark has billions that he's trying to spend. So if you have any good ideas, I'd encourage you to call him at home, call his offer him an idea. He really likes this kind of reader feedback. Tell us just a little bit about...
Our money all goes to David over there.
Tell us a little bit about the areas that the Gates Foundation is funding that you are most excited about right now, that are potentially the biggest breakthroughs.
Yeah. So basically the foundation's primary focus is really on health and development issues, which we think can have the greatest catalytic impact on addressing global poverty. So on health, that's driven us focus very much on infectious diseases, which are these HIV, TB, malaria, issues like that, vaccinations more broadly, which David will talk to and is really the bread and butter of what GAVI does. And so huge amount of work both into the R&D side, how do you develop cheaper, better, lower cost vaccines, drugs, other interventions, and then also delivery mechanisms around that. So across the sort of health spectrum, that's the main area of focus. And then increasingly, and this happened sort of in the latter 5 years, the foundation's now 13 years old, so it's really only an adolescent. First 5 years was very health focused and then widened out, looking at where are other areas that might be open to that same kind of catalytic set of interventions. And there, the most exciting area has been agriculture, which is really smallholder farmers who are 70% of the world's very poorest people are rural poor, and the vast majority of them are smallholder farmers, largely South Asia and sub-Saharan Africa. And they're very small incremental increases in productivity, providing some tools, some access to credit, access to fertilizer, access to improved seeds that might grow better in drought-resistant conditions. Those are the kind of investments we've been making some very big investments in, huge poverty-alleviating impact, and very much self-sustaining when it works, because these are farmers who are then able, largely women, able to then sort of invest in their own farms, in their own children, send their kids to school. It's a very virtuous cycle. So we've been spending a ton of work and energy there. And maybe just one other area just to sort of put out there, because it may generate some questions, where we're very excited about the potential is financial inclusion, which is really how you're getting financial services to the very poorest, where that's sort of one of the biggest gaps and handicaps. Many people are aware of sort of microcredit and that whole revolution, but really the advent and the revolution of the mobile phone is helping just drive down costs, increase access, open up a whole lot of opportunities that just simply weren't possible as recently as 2 or 3 years ago. So we're very excited about that area too.
David, tell us a little bit about your role at GAVI, what GAVI is, and how you became engaged in this world.
So I'm David. I came out to Magdalen in 1986. GAVI stands for Global Alliance for Vaccines and Immunization. We're a public-private partnership. Happy to speak more about that. And essentially what we try and do is to make a significant contribution to leveling the global playing field by making available to kids in the poorest countries of the world the package of vaccines that kids in the richest countries of the world enjoy. And we aim to do that on a sustainable basis so that it endures permanently, and very happy to talk about how we aim to do that. My role at GAVI, I'm the Managing Director for Innovative Finance, and what that means is really two things, essentially. On the one hand, structuring creatively so as to attract resources from a wide variety of sources, and on the other hand, structuring so as to deploy those resources in the most effective and efficient manner possible so that we and the people who fund us get the biggest bang for their buck. So the rubric that we use to describe the work I do is more money for health and more health for the money. And I won't bore you with how I got here, but maybe we can.
That's what he also writes on his grant report.
That's right, at least the first part.
I mean, one of the frustrations about people interested in global health is that so much money goes into rich world problems from drug companies and so little into ailments of the developing world. I mean, and GAVI is really kind of a remarkable and recent effort to address that. Can you just explain a little more about how GAVI came about and what it has changed in the field?
Sure. So maybe just to take a step back and briefly ask the question of why immunization matters and why global immunization matters. And perhaps one way of getting into that is just looking at how child mortality, the number of kids on the planet who die under the age of 5, has evolved over the last couple of decades. And in a nutshell, it's been a dramatic reduction. And a lot of that reduction has been due to the globalization of immunization, unsurprisingly. So, in 1990, there were 12 million kids on the planet dying before the age of 5. By 2000, that was 9.6 million. Now that's around 6.9 million. And obviously the denominator has changed because global population has grown significantly over that period. So as a percentage, the reduction is even more dramatic. And the greatest burden of child mortality is in the poorest countries of the world. We work in the 73 poorest countries of the world, 60% of the planet's birth cohort, and that's where most of the burden of infant mortality is. And, the sad reality is that much of that is preventable by a cheap and effective technology, and these are senseless deaths that shouldn't occur. But in addition to saving a life and making sure that the individual can continue to live, I mean, much of immunization is about quality of life, is about morbidity, is about the absence of disease, is about the absence of physical and mental defects, and the ability to go to school, and the ability to retain information, the ability to not have your parents, particularly if you're in a poor environment, having to take time off, income generating time to look after you. So it has a significant effect ultimately on, as I say, leveling the playing field and on socioeconomic development. And that's why immunization matters and why intuitively we all get our kids immunized. But that's why it matters from a global perspective. And as I say, there's a big success story there, but a lot of challenges remaining, which maybe we can talk about later. Directly in terms of your question, Nick, I mean, so as I said in my brief intro, the objective is to globalize something that, as you say, where you're talking about products and interventions that have traditionally been manufactured essentially for the rich world, but also to do that on a sustainable basis. And so in 2000, GAVI was established. Bill Gates, indeed, was one of the pioneers involved in that, both from a thought process point of view, but also from a funding point of view. And the idea was essentially to bring all of the players together under one roof in order to address the challenge. So if you look at our board of directors, it is massive. We have 28 people on it, but it includes, vaccine industry. It includes developing countries, health ministers from Senegal, from Bangladesh, elsewhere. It includes rich countries that fund us. It includes the Bill and Melinda Gates Foundation, the WHO, UNICEF, the World Bank, research institutes, civil society, and it's a true public-private partnership. And the idea was to say, let's first of all focus on what happens in the vaccine industry. And let's acknowledge that for many of the products that the vaccine industry, pharmaceutical industry brings to the market, in this case vaccines, the essential business model is one of, in relative terms, low volume and high margins. So let's find a way, but the prices that produces are just not affordable for most countries in the world. So let's find a way to bring prices down in the countries that need those prices brought down, but in a way that works for industry and makes it sustainable. And so, in a nutshell, over time, what we've worked with industry on is to create a pricing model that is tiered for different parts of the world, and the prices that the countries that we work in have access to are very, very dramatically different, and we can talk about those compared to what, say, in the US we would pay on the open market. But the corollary of that, the quid pro quo for that, has been to say, look, we will give you great certainty of demand, forecasted demand. We will give you great financial certainty over the purchases that we will make. And we'll give you long-term commitments to purchase from you so that you de-risk the market for them. That's kind of one component. The second component is working with countries to make sure that we fund and that we assist them with partners to have the health systems, and in particular the immunization systems, so clinics, cold chain, syringes, nurses, transport, to get vaccines out to where they need to be gotten. But then also the fiscal and political commitment to introducing immunization programs and taking over the full fiscal responsibility eventually. So every GAVI vaccine that we fund is co-financed by the developing country concerned that implements, which means that from day one, you have not only the health ministry, but also the treasury involved in the decision from a budgetary perspective, and often the legislature involved as well, because often these involve budgets that go through parliaments. And the deal is, at the beginning, you will co-finance a relatively modest proportion of the cost of vaccines, but as time goes by and as you grow, you co-finance an increasingly greater proportion until you get to a point. Currently, that point is $1,570 gross national income per capita, and at that point, you graduate from a financing perspective out of the GAVI system, and you have 100% of the fiscal burden. And then obviously the final component, though, is that in order to make this happen and to roll out vaccines rapidly over the world and to take our share of the financing responsibility, we need quite a lot of donor money to make that happen. And so currently we are spending around $1.7 billion a year to acquire vaccines.
You mentioned progress in mortality, in child mortality, which is truly extraordinary. And just to kind of make it, kind of real, I'm curious, I bet a bunch of you have at one time or another had malaria. How many people have had malaria here? Good Oxford crowd. I hope you got it on Oxford vacations. And if you're studying international development, you should claim extra credit for getting malaria, too. Malaria, of course, is an area where there has already been tremendous progress in recent years, and I would have thought that it's plausible, partly because of your work, partly because of work on vaccines, that 15 or 20 years from now, it may not be completely eradicated, but as a major public health problem around the world, it will be. Is that too optimistic?
Probably. Well, the Gates Foundation were famous, or our co-chairs are famous for calling themselves impatient optimists. And a few years back, they called at a panel for the eradication of malaria rather than the control of malaria, which was a rather controversial call at the time because it is seen as such a sort of impossible dream given the scale and just challenges around malaria globally. That said, it is true, since 2000, malaria attributable deaths have dropped around 25%. That's a sort of 1.1 million odd deaths that would have happened on previous trajectories that didn't happen. The reason they didn't happen is better access to treatment, particularly better access to things like bed nets, where there's been dramatic increases in distribution in the most endemic areas. But the fact is there are challenges, that some of those gains have been at risk. You get mosquitoes learn new biting patterns. So instead of biting at night, they start biting at dusk before the bed nets are there. You get greater resistance. There is a resistance to the different kinds of drug combinations, which is growing, particularly in some areas in Southeast Asia now, and you need to try and accelerate to get ahead of that. There's been a lot of work done searching, and we put in a large amount of money as the foundation into looking for a vaccine. And there's been a new product, recent trial results called RTSS, which has had, so unfortunately the results are sort of right on the cusp. They're encouraging enough that there is some level of prevention that you think maybe we should keep going, but they're not so encouraging that it's really a comprehensive breakthrough in the way that many of the other vaccines that Dave and GAVI work on issues like sort of pneumonia or rotavirus, which causes diarrhea. So malaria is a really good example of both, the optimism of the progress is very real, the momentum is real, the way in which governments are taking it seriously is real, and then the impact that those improvements have on society is much more than just health averted. The productivity costs of malaria in endemic countries are huge because it's days off work, it's days not being able to be in the field for children. It has a disproportionate impact on sort of health, ability to go to school, and so on. So this is a huge impact. The trajectories are positive, but the challenges are still very, very real. And we hope that there will be a stronger vaccine candidate in the future, and we hope that there will be some other interventions, but it's a constant race.
You're an impatient realist rather than an impatient optimist, maybe.
Well, an optimist in that, the bottom line is things have been getting dramatically better across a very wide range. I mean, David just gave you those child mortality statistics, which are stunning when you think about them. I mean, that drop is just enormous. Many of you may be aware of these goals that were set at the UN in 2000, the Millennium Development Goals, which include a trajectory of reducing by 2/3 child mortality from a baseline of 1990 to 2015, which is the coming deadline. And that seemed like an almost impossible number. And then to the extent that there had been progress, people saying, well, it's just progress in China, very important though that is, and huge amounts of impact. But actually, you have, as of the most recent statistics that came out, that countries like Ethiopia, with 90 million people, has just met that target. Now, it's important to put it in perspective. Again, Ethiopia's, I think it's around 1 in 15 children will still die before the age of 5, as opposed to the norm in Europe would be somewhere around 1 in 200. So it's a dramatic difference, but that is down from 1 in 5 in 1990. And you look at the same kind of numbers on hunger, again, sticking with Ethiopia, which is a country where we do a great deal of work. It's famous, almost notorious for sort of famines and hunger. And it's true that depending on the statistics, and there's always a lag with statistics, but somewhere around maybe a little bit under 2 in 5 Ethiopians are still chronically hungry, undernourished, which is a terrible number, whereas it was 2 in 3 just in 1990, and the population is much larger, again, now than it was in 1990 because there's been significant population growth. And you can look across all of these things. There's been improvements in education, in wider sets of healthcare, and a big chunk of it is around the infectious diseases because, as you say, there are big investments, you were saying up front, into, if you like, the diseases of the rich, heart disease, other things like that, which are very important and are increasingly becoming diseases of the poor and at least middle-income countries too. But when you look at the disease in the very poorest countries, it is still overwhelmingly the infectious diseases that lead to that mortality, and that's where the kind of investments we're putting in are. And the optimism comes from the fact that the trajectory is positive, and actually, again, the numbers, even in many of the poorest countries, in Eastern and Southern Africa, the progress between 2005 and 2012 was faster than between 2000 and 2005 on those mortality reductions. So the acceleration is increasing. The aim is to keep that going. But again, to the malaria challenge is, we're realistic and optimistic if we can be both at the same time.
Let me ask you about failures of the humanitarian community, because one can learn as much from failures as from successes. In the context of this extraordinary improvement in child mortality in particular, and improvements in morbidity and nutrition and so on, what do you think are the big mistakes the humanitarian community has made? And let me toss out a few ideas of my own. I mean, I think that one is that until recently, everything kind of went much more on gut than on really solid metrics. I mean, the business community was way ahead of the humanitarian world in really rigorous evaluation. I think that's changing. A second is that I think the humanitarian world wasn't aware enough of insecurity and the way that insecurity in one country can be contagious and spread through another. So in West Africa, you had problems in Liberia that caused the collapse of Sierra Leone as well, of Ivory Coast, threatened Guinea, and so on. And in Rwanda, problems there, eventually went not only on to Burundi, but to Congo itself, and so on. And in that context, you can't, when you have warlords running around, massacring clinics, then you just can't do health interventions. And finally, I guess I'd say that I think the humanitarian world hasn't been very good at tooting its own horn. There is this, both NGOs, and because they're always looking for money, and so they're talking about needs, and we as journalists, because we cover planes that crash, not planes that take off, so we focus on the needs and the failures, and I think that has left the world with this impression that Africa in particular is this kind of disaster area. And in fact, I do think that there's been this remarkable progress, and that we need to do a better job figuring out how to acknowledge the needs while also really emphasizing this extraordinary narrative of success that is in the backdrop. And your thoughts about failures?
So I think, first of all, just to go back to my own organization, to be fair, I mean, I'm not sure failure is necessarily the word that I would choose. In fact, it's not the word I would choose. But, I mean, I painted a picture up front of extraordinary progress, and I think there has been extraordinary progress. So some of that, by the way, is quite difficult to intuitively imagine. I mean, for example, we had a discussion, you and I, Nick, about Africa, and is Africa different? The answer is no. I mean, if you look at the way that basic immunization rates have gone in Africa over the last decade, it's been astonishing. And you can go onto our website and look at the coverage rate for diphtheria, tetanus, and pertussis, DTP3, which is a good measure of basic immunization, and is there a basic immunization system in place? And you'd be astonished by the number of countries who are at what is now the average in our world, in the 73 poorest countries of the world, which is 80%. So that's incredible, and that's across Asia, Latin America, and Africa where we work. But the flip side of that very coin is that 1 in 5 kids is not getting even the most basic of vaccines, and that is a significant remaining challenge, which speaks deeply to equity, because very often you're finding those kids in the poorest parts, in the poorest communities, or in the geographically distant most distant communities, which sometimes overlaps. So there's big challenges there. We have massive challenges to confront in the area of sustainability that I mentioned to you, which we grapple with. I said that countries graduate out of our system, and indeed they are graduating out, but that doesn't magically mean that they continue and can continue these programs forever. We still have to grapple with the issues if we're not supporting them financially. How is it that they have access to the right price point? How do they collaborate to be able to provide a big market and pool their procurement? How do they forecast demand and operate together? We have issues, I mentioned a last example, which is the the global supply chain around vaccines. How does it get from a factory in Singapore to a kid in Mozambique, in a distant part of Mozambique, efficiently, so that there's no wastage along the line, so that we know exactly when vaccines are going to expire, and so that we don't, so that we optimize both the lives saved as well as the dollars that we're employing. That system is very imperfect when you compare it to a lot of what we observe in the private sector. So these are a lot of the challenges. I wouldn't describe them as failures necessarily, but really big challenges that remain in order to get the job done. I agree with you that metrics, introducing metrics is critical to know whether you've succeeded or failed, what you failed at, and what has worked well, and then to build on that is absolutely critical. Otherwise, you're just lost at sea. So there is controversy about the Millennium Development Goals and the content of some of them, and so on and so forth. But I think the one thing I would strongly advocate for is just putting a marker in the sand and saying we can measure it, and we can talk about the way that Mark was talking about child mortality earlier is very important. And if you look at, if you go and take a look at our website, you'll see that we really do plant our flag. So we say, these are the strategic objectives that we are trying to achieve. This is, these are the way that we'll measure whether we're going to get there, and we will transparently say to the world how we're doing at any point in time. And so on something like, for example, what is the rate of immunization coverage on a particular vaccine compared to what we planned? And so we measure ourselves rigorously like that, and I think that is an increasing trend that you see. My own view, finally, is that when you look at development broadly speaking, I think you spoke about humanitarian interventions. I forget the exact term, Nick, but when you think more broadly about the area of development and development interventions, I think that for various reasons, the sort of rich country community and the donor community and the development finance institution community has neglected beyond lip service, has neglected the real issue of country ownership and the need for local communities, local governments to own programs if they're going to be sustainable over the long haul. And that has led, I think, to, and to some extent that's a function of incentives in the communities that I've mentioned, in the resource-rich communities, but that has led to, I think, an unconscionable amount of kind of white elephants and ports and power stations and roads and things like that probably shouldn't have been built, or if they were built, should have been built in a different way with more of a view as to how they fit in the big picture and how they would be sustained. So I think country ownership and sustainability is a big theme.
Mark, this is a battle, and in a sense we're losing, a public relations effort anyway, that especially at a time of economic difficulties around the world, I think there are an awful lot of people who think, why worry about vaccines or malaria in Malawi? Let's fix our own problems at home first. And I was struck by a Pew survey in the U.S. earlier this year that asked voters about, I think it was 23 different areas of the budget, and the one area the Democrats and Republicans agreed should be slashed was humanitarian assistance. And I think that in a difficult budget environment, it is going to be, I think that argument carries tremendous resonance. Let's fix our own problems first. So obviously the Gates Foundation, you do work on schools within the U.S., but you're focused on global health. So how do you answer those people who make that argument?
Yeah. So first of all, you're right. It is a huge challenge. It's a challenge that's only got tougher, and this is persuading countries in the rich world, the developed world, to continue fund and support overseas development systems, international aid. And the irony is this feeling and perception has absolutely grown in the post the recession in 2000, at exactly the time the aid industry is arguably having its greatest impact ever, because it has very belatedly learned a lot of these lessons. It's much better about metrics. It's much better about evaluations. It's much better at working directly with countries and trying to build the sustainable country ownership that David was talking about. That's not at all to say it does it well or optimally. There are huge gaps and huge mistakes, and it's learning all the time because these are incredibly complex issues. but it definitely is more impactfully spent, and you're getting more lives saved, more kids educated for the international aid dollar or euro or pound than any time in modern history. But traditionally, aid is also seen as a political tool. Really until 90, part of the reason you didn't have those very rigorous evaluations and so on was really up till 1990 and the end of the Cold War. Aid was primarily a Cold War political tool. There was lip service about anti-poverty agendas and so on. But if you actually look where the resources went and whether many decades of money going to Mobutu in then Zaire, now Congo, those kind of things really helped give aid a bad name and still have the stereotype that, oh, well, aid will just go into a country here and then back out to a Swiss bank account there, which is really not the case for the large majority of aid. It's certainly not the case for the kind of work that GAVI does or the Global Fund against HIV, TB, and malaria and lots of that work. And so part of what we try to do with the foundation and Bill and Melinda Gates are personally very passionate about is just trying to tell that story and say, here is the impact. Bill Gates, puts a very high premium on value for money and investments. He does not put money into areas he does not think are high return, and he thinks and believes, and we think we have the numbers, that some of these investments in human health and poverty alleviation are the best and highest return investments it's possible to make. But it's a very difficult case to make, not just because of the perceptions, but also because it's widely misunderstood how much money goes to aid. Those same polls that say it should be cut, most people in their routine surveys, which are very consistent over the decade, think that around 10% of the US federal budget goes on aid, and the actual number is just under 1%.
And only half of that on humanitarian.
And half of that on humanitarian. So a lot of that goes to, aid covers a wide range of sort of issues and expenditures. In the UK right now, it's actually a very interesting story where the David Cameron's government has been phenomenally good on this issue. They've made it a signature part of their sort of commitments to bring British aid spending up to an internationally agreed commitment, which historically only the Nordic countries, Norway, Sweden, and Denmark, had reached, of 0.7% of GDP spent on international aid. Be getting massive blowback. All you have to do is pick up the Daily Mail while you're here, or a couple of others that just say why this is shocking and terrible. And of course, it's okay to spend on humanitarian. If people are starving, we, the British people, will absolutely respond from the goodness of our heart, and you get those same responses in the US or other countries. But that we don't want this aid going money down a rat hole, everything, to take Jesse Helm's old comment. And it is a challenge because, going back to your original question, some of the stereotypes of development, the things that have exacerbated particularly the image of whether it's Africa or the Haiti disaster, whatever it is, that general public still do respond pretty powerfully to humanitarian appeals. When you did have the Haiti earthquake, there was a tremendous response from the American public around it. And so that's still what generates people willing to put their hand in their wallet and give money directly, or say we can have some taxpayer money. But then the actual development taking place, what we were talking about, those child mortality statistics, but writ large across a range of development indicators, are what helps build the resilience within these societies that they're not going to need aid in the future. And that's the issue that's not fully understood. It's a difficult story to tell, but it's like the narrative I was talking earlier around agriculture and how it can become self-sustaining and generate its own momentum. And that is exactly what's happening in large chunks of the developing world, and it's really important that that money not dry up now. But it's a tough uphill fight, no question.
I'm sure that a lot of you folks are writing checks at the end of the year, kind of wondering whether it's effective or not. I wonder if you guys are in the business of giving away money or spending it. What guidance do you have for any of us? I guess after we've written our check to the Rhodes Trust, maybe, about, I'm not so much asking for a particular organization to give to or even a particular cause, but what mistakes do people make that that just drive you up the wall, or what should we be thinking about when we're making our own charitable donations?
Yeah. Well, the way we operate, obviously, is as a grant, a large-scale grant giver to organizations. that both do some of the research work, but some of that delivery work. What you're looking for, again, is just sort of general transparency in the company. Are they very open about where the resources are going? Are there metrics of the measurability of impact? How are they assessing it? What are the ratios of sort of overhead costs versus implementation costs? So there's some very good tools out there that help look and assess that. Again, increasingly, what we're interested in, and it's a very challenging. I mean, when we go back to evaluation, we do this as a grant giver all the time, and actually we get a lot of grief from some of our grantees, of course not GAVI, but about that we're sometimes overly rigorous and our grants process can be incredibly painful because we're trying to map out what are the milestones in year 1 or year 2 or year 3 that we think would be satisfactory outcomes for the return of dollar to help trigger subsequent year payments. And it is complex and cumbersome because it's not a sort of simple equation. You put money in, you get these human outcomes out the other end. And we're always learning and we're always seeking to recalibrate it, but really what you're trying to get is organizations that are honest about the challenges, open, you can see it in their annual reports and their websites and in some of the other issues, and are constantly trying to learn. And in terms of what the issues are, I think everyone has particular issues they're passionate about. As you say, I'm sure while we're here, the Rhodes Trust and the Mandela Rhodes Foundation would both be good sources, but there are many, many others.
Yeah, I think I think that's right. It's entirely dependent, I think, Nick, on your motivation. And I think there's always a place for just looking after your neighbor. And when you talk about the humanitarian relief or disaster relief type of situations, I think that's what applies there. But equally, you may be interested in a school in your own backyard or a clinic in your own backyard. What we wrestle with, and one of the things, particularly from my perch at GAVI, that I'm most interested in, is how to make different sources of capital that are often at different scale, with different motivations, and that come associated with different skills, sing together in harmony, so that the whole is greater than the sum of the parts. And so we have, although as I said, I mean, we're operating at the scale of billions. We have individual donors. Sometimes we give relatively modest amounts. We have corporate donors. We have, JP Morgan, Vodafone, Anglo-American. And, in those cases, what we are trying to find is an alignment of interest and an alignment of motivations, and trying to make sure that someone who comes in and says, but what difference can I make, what difference can my dollar make, is to really make the case. And it depends on what your motivation is. So first of all, if you just want to see your money well spent and you want to be clear that you'll get transparent reporting on what it went into and want to be sure that each dollar had the impact that was intended, that's a motivation that would suit us. But on the other hand, if you want to do something where your motivation is, for example, catalytic, I want to get involved in funding something that you guys are interested in, which may seem a little risky or out there, but if it comes off, then it is something that I can look to you guys to take to scale, to take to a number of communities, a number of countries, and so on, and then ultimately I will have been part of something much bigger. Then again, we're trying to find the way to do that. But at the end of the day, I think if you're making the background assumption that you want your money to have an impact, and that you want and you want that to be proven in some way, then I think what Mark's saying is quite right. I mean, the more transparency, the better. And certainly I know at GAVI, I mean, anyone who's gone on our website can see we're transparent to a fault. I think we just throw everything up there. And the more that you measure yourself, the better for everybody ultimately. And so we're very committed to that. And actually, in all honesty, we have, zero frustration, as Mark knows, with the idea of the Gates Foundation being one of those funders who's very exacting and pushes us, because we're right there with them wanting to do exactly the same thing for the same reason.
Yeah.
My advice partly would be don't spread yourselves too thin. I mean, I think people often, they get a heart-rending letter and send in a small check, they do that often. And I just think that ends up being very inefficient for that organization. Your money is much better off going to in bigger checks to fewer organizations as a matter of efficiency. And I think another bit of advice would be, I think people often get assessed by Charity Navigator ratings, and those can be useful guides, but administrative expenses aren't, I mean, the amount spent, what matters is impact, not necessarily the administrative expenses. And it's, you know, it's a complex issue, but look for impact. And there are some other guides, things like givewell.org that kind of try to assess impact rather than just the question of administrative expenses.
Yeah, well, I mean, one point which is actually an interesting one, which we confront a lot, is the tension between the challenge, and we certainly with our grant are always challenging our partners and organizations to look at new approaches, to take risky bets, to try something different that's going to have bigger impact. And the consequence of that is a number of our bets will fail or won't work or won't have that degree of impact. Mm-hmm. But that's very challenging, especially for non-profit organizations, but also equally for-profit ones that we partner with, because you want to be demonstrating that every dollar that came in had an amazing impact. And so it is a challenge, and it's something to be aware of. And it's admittedly, he was giving it a scale that pretty well no one else on the planet can contemplate. But it was very striking when Warren Buffett made the initial announcement that he would give the bulk of his fortune to the Gates Foundation, which he does. He gives a certain proportion of Berkshire Hathaway stock every year, which we're expected to spend during that calendar year, and he will keep doing that. And he came into the foundation for this initial, it's breathtaking. Wow, you've given your money to somebody else's foundation. He's also helped endow his children's foundation, but the bulk is coming to the Gates Foundation. And I remember a colleague sort of asking questions, say, well, Mr. Buffett, you're famous as the world's best investor. What are the lessons you've got from your investment process that we should be applying to our work at the foundation? And he looked at me and said, you really shouldn't be. He said, because when I make an investment, it's a very, very sure bet. I've done my due diligence. I feel very confident and very comfortable about the impact of my investment, and that's what I do. But for philanthropy and the money that I'm giving you, you're dealing with nutty, thorny problems which are very, very difficult. And using a baseball, if you're not swinging and missing 2/3 of the time, you're not trying hard enough. If I wanted just high impact and return, I would build the world's best park outside my house. And I know I could make that meticulous. That's not what I'm looking for. I'm looking for you guys to grapple with these really tough issues. And I'm very comfortable with failure because I hope that will breed success. And that is a tension that definitely runs through the industry.
I'd like to open it up to other people for questions, comments. Way in the back.
Yeah, Tim Reed, 1960. It's a more general question. I mean, it's so desirable what we are hearing in terms of the vaccinations of young children. And so I hope my comment isn't brutal in any sense. That means an increase in population. And that in itself is an effect of doing something very worthwhile, saving lives.
But does it run into the Malthusian problem that then it becomes,
Yeah, I mean, it's, and I guess my answer to that is, if the parents, I lived in India for a while, and you know some of the villages, parents want to have a lot of children to help with the work in the field. If their perception is, I'm only going to have the same number of children as I had before, even though 3 of my 5 children are still alive and 10, then that is a very difficult mathematical equation to work out. And so my question is, can you, or would you, or is it within your horizon to tie what you are doing into birth control to the women?
Well, the very straightforward answer is yes. And in fact, family planning is one of, and I should have mentioned up front, one of the biggest areas of focus for the foundation, and a particular passion of Melinda Gates's. And in fact, the whole area of family planning is an interesting one because It's one that got relatively neglected globally from around the mid-'80s, paradoxically almost a victim of success of some of the big conferences, the Cairo conference and the Beijing Women's Conference, and some of that, and it got very politicized. The whole issue of family planning, reproductive health, certainly in the United States, is a thorny political issue. It cuts across personal religious issues. And the same kind of thing we were talking about drugs. There was a real drying up of investments in new types of family planning products that might be accessible or affordable for many of the world's poorest. And the interesting thing on family planning is with the demand, exactly what you're talking about, there's a combination of as children survive and as families see their children more likely to survive, they do start to have fewer children. There's no question there's a lag, but this has happened, there's very strong demographic evidence across a very wide range of societies that as that visibility happens, the number of children families have goes way down, the investments they are able to put in the surviving children go way up. What you do have, and this is a kind of demographic bulge, because as you're getting those improvements in child mortality, there's still a time lag effect. You need to have enough families seeing that impact around them, understanding that your children are likely to survive. And done right, what that can trigger is then a demographic dividend, in the phrase that what you have is a cohort coming through a larger, which if it's done at a time and in societies that are starting to generate the kind of economic growth and opportunities that we're certainly a lot of Southeast Asia and East Asia went through exactly that process in the 50s and 60s, and some countries like Indonesia and others a little later in the 80s and 90s. We're starting to see some of that in Africa, but there are wide divergences. There's no question that a country like Niger, where I think it's still average around 7 children, or 6 children, it's come down a bit, but it's still very high, but I think it's the highest in the world, is, that is a real challenge, but absolutely the combination of family planning and accessibility to family planning, because there is huge unmet demand, and particularly among women, because it is key to get that, both the education and the access for the women, then you do start seeing those positive effects, and you want to do both at the same time.
I would just add that, I think there's a perception that family planning is about condoms or IUDs or injectables, this kind of thing. And obviously you need those commodities, but educating girls has a huge impact on fertility rates. And it may well be that you get, there's some debate about this, but it may well be that you get more bang for the buck on the total fertility rate through girls' education than you do through family planning programs. You obviously need both to some degree, but yes.
You all talked about the importance of working with the governments in these various countries. It's important that they buy in and eventually graduate. But many of the countries you're talking about are perhaps dictatorships or semi-dictatorships, or are plagued by great political instability. There's ample evidence of that. So how, in the face of political instability, corruption perhaps, do you deal with these governments, get them to buy in, ensure that the funds and the programs you administer are done the right way?
Right. Good question. So first of all, we work across all countries. We're beyond the issues even that you raise. We're in the North Koreas of the world, we're in the Cubas of the world, we'll work anywhere that fits in the income category that I mentioned to you. And certainly we deal with political instability. We're in Somalia, in the Sudans, in the DRC, and lack of reach of the state apparatus. DRC would be an example of that also. So then, we have to be pragmatic and improvise. So our view is that the first stop, for better or for worse, is always the government health system. Sometimes that is a national health system, and sometimes that's a state or provincial level health system. But that is really where we start. And if we think about most of the countries where you have a health system that really provides equitably and fairly in Europe, for example, to most of its populations. That's really the fundamental model, and so that is our starting point. But we do acknowledge that there are many places where, for the reasons you mentioned and others, that doesn't go all the way, and so then we team up with others. In the case of refugee camps, we will team up with international relief organizations. In many countries, we will team up with local or international non-governmental organizations, not just on things like getting the word out, but on actual implementation. So, for example, in countries like the Democratic Republic of Congo and Zambia, we work with local church groups who will actually run clinics and run immunization programs. Typically, we negotiate to integrate that into what the government does. So negotiate for an acknowledgement by the government that it's run out of steam in many regions of DRC, for example, and so we need to make these alliances and make the whole system function together, but that they won't be able to provide the solution. On corruption, I suppose we're in the fortunate situation. By the way, on your overhead question, I agree with you entirely. I mean, we, for better or for worse, make a virtue of the fact that our overhead is particularly low. It's around 3.7 or 3.8%. So the bulk of our money, say 95%, out of that 85% we spend on procuring vaccines, the commodity, which has to be refrigerated. And it's the commodity that we then ship to the country and then work with UNICEF and with local partners, including the government, to get it around the country in a refrigerated environment. And it's not something that has a street value. And it's provided free of charge to the end user. So we're fortunate that for most of what we do, there's, relatively speaking, a low risk. Now, so that's 85% of what we spend a year. 10% of what we spend a year is cash. And that cash gets dispersed to national governments, to local governments, to non-governmental organizations, to others, relief agencies. And very often that is predominantly for the immunization services that I spoke about up front, for clinics, for training of nurses, for syringes, that type of thing. So it's a relatively small proportion of what we spend, but it's still significant number of money in the aggregate. We try and work with partners in the international development community and locally and elsewhere to ensure that the controls are baked in to the way that we disperse and monitor funds to make sure that those funds are responsibly used. And by and large, that is successful. But from time to time, some of that money is either innocently, actually, or not so innocently misused. Innocently is, I thought this was a medical expenditure that qualified, and it just doesn't happen to. Not so innocently is other stuff, and then we go after it. And then at that point, we will not disperse any more cash into that country. We will continue to fund to ship vaccines, but will not disperse any more cash until the money has been repaid, and until we fix the problem that was underlying it. And what's more, we do all of this transparently. So again, if you go to our website, we come out at the earliest possible moment. We tell you exactly what's going on in which country and what we're doing about it, and we shine a bright light on it.
Yeah, I mean, maybe just a point to add to that. I think vaccines is one of the areas that can actually operate even in war zone refugee camps, and also that often you do use, and GAVI and others partner with NGOs, with UNICEF does a great deal. If the systems aren't working, there are alternative models. They're not as sustainable. Obviously, the long-term vision of success is a stronger and more robust primary healthcare system, which tends to be very difficult to build. In sort of our general work as the foundation and the foundation's directors, or when we give to an organization like GAVI or the Global Fund, they operate multilaterally in the way that David talks about. When we give directly, or we work with organizations to work about, we tend almost by default, and now increasingly by design, to go into places where there is political space and opening, because that's where you get the momentum. We're not really, a foundation based in Seattle isn't in a position to sort of kick doors open or do things differently, but when there is, and to Nick's original question around humanitarian issues, it's true, so much of it is about political will and political commitment. And so if you take an example of the state of Bihar in India, which is the poorest state in India, 90 million people with demographics and indicators that are actually worse than Ethiopia's, there they had a long track record of sort of dismal development failures, and then about 5 years ago, a new chief minister, Nitish Kumar, was it had always been a very sort of ethnic, politicized, sort of fairly corrupt system, and he came in as a technocrat saying, I want to come in and really try and transform some of these things, and was looking around for partners, came to us and said, would we be willing to develop a partnership, which we then have a range of other half a dozen partners on the ground, to start transforming, working to try and transform some of these things at scale. And the results have been very impressive. Again, of an incredibly low base. He actually just got re-elected, which shows that technocratic success among the very poor can buy you votes, which is a good revelation in India, and a very positive one at state level. And so I think that part of the thing, and the success stories that we've talked about, the countries like Tanzania or Ethiopia, when I was talking about the agriculture work, these are governments that have been willing to make the investments, to put the resources, and then are very open to advice. It doesn't mean some things might not go wrong, and we do try to monitor very closely, but it does require that sort of open door and willingness from the governmental partner in the first place.